Hi, everyone. We're the Public Health Committee, and we will be talking about obesity. Um, so here are some of the things that we want to be able to know by the end of this conversation or this presentation. So the first thing is know what obesity is. And the second is, understand why obesity can be dangerous and what can lead to obesity. And then lastly, how to help prevent obesity from happening to you and to me, to everyone.
So the first thing that we want to cover is what is obesity. And so being overweight or being obese are kind of general terms, and it means that you have too much fat in your body, and this can lead to a lot of severe health consequences. One common way to measure this is a thing called the body mass index. You might also see it abbreviated as BMI. This is a tool that we use to measure obesity and weight, and it measures your weight relative to your height. And so if you have a number between 25 and 30, you are considered overweight. If it's over 30, you are considered obese, and over 40 is considered severe obesity. And so in 2010 alone, in the United States, 3.4 million deaths were caused by obesity. But over the last 20 years, this percentage of people in the United States has increased a lot, actually. So from 30% to about 42%. And the number of people with severe obesity went up from around 5% to 9%. So with these numbers, about 70% of Americans are either overweight or are obese, and this tends to affect minorities in a disproportionate way. Specifically, 5 out of 10 Filipinos are obese.
And so, what is dangerous about obesity? Well, this complex disease often has a lot of effects downstream. Uh, so, for example, the ones that we know are things like heart diseases. When people say, oh, my cholesterol is high, that causes heart disease. Diabetes, which we know is very present in the Filipino community. High blood pressure, cancer. Some things, though, that some people don't think about that obesity can lead to is arthritis and gallstones, and those can be really painful for someone. And so, of course, we want to help prevent obesity in any way we can. Another thing is infertility and the quality of your life. The reason why it affects the quality of life is a few reasons. First, of course, or the most often is just the idea that obesity can cause a really big financial burden to someone or strain because having something like obesity costs a lot of money to go to the doctors and get these checkups and medications. And as you can see from this list, it's not just obesity that you're treating, but rather a lot of other things that could happen if you do develop obesity. And now I'll be talking about what can lead to obesity. And so, of course, there are a few things that can, and there's multiple factors, but just know that some of them are things out of our control. And so it's important to be kind to yourself when you are managing your obesity, if you happen to have this disease, but also just understand that we can do things that are in our control. Later on, Darius will talk to us about that. But I'll talk about the things that are kind of out of our control. So the first thing is the environmental factor. And what that means is just not having a safe place to work out because you feel like your neighborhood is dangerous, or, environmental also means where are you, and are you close to fast food restaurants like McDonald's and Burger King, or do you have access to fresh fruits and vegetables from nearby grocery stores? The second thing is finances. And so, of course, if you're not able to afford any fresh produce, or you're not able to afford a gym membership, or, equipment like good running shoes to go out running, that's going to affect how much you exercise and, obesity. The third is biology. Sometimes it's just in our DNA that we have things that can cause for more obesity. And then lastly, there's pregnancy and child development. So what nutrients did you have when you were a child, and how did that affect you? These are all things that can affect obesity. And again, these things may not necessarily be our fault or in our control, but there are ways that we can help not mitigate, to change that and manage obesity. Now is the time to really kind of look at what obesity looks like. And it's a complex disease, and kind of change our mindset around it. So, first, to demonstrate this, we're going to go into a story of the life of John. John goes to a family party after COVID, so it's all safe. And John is going to go eat because he's hungry, and he reaches out for the food, but then his tita stops him and he says, John, mataba ka na, anong nangyari? Or you're fat now, what happened? And we kind of just want to reflect of how that made John feel, and maybe why John may have gained some extra weight during COVID-19. Yeah, thank you everyone for answering. Yeah, it looks like there's a lot of comments on here saying that, obviously it doesn't feel good to be called out about your weight, and also about things that sometimes aren't necessarily in your control. And something in an unhealthy manner like this, I think if, his tita was concerned about, his health, then there are, better ways to approach it, saying, hi, John, how are you doing? How do you feel? And, how has this pandemic changed you? And, what are ways in which you want to get better? I think maybe his tita didn't realize that there are other factors that could have happened to John that made him put on a little bit of extra weight. So, for example, maybe John was scared to go grocery shopping because he didn't want to get COVID and he was scared of that. So instead, he went to go to McDonald's drive-through very fast because it was fast, cheap, and he didn't have to interact with a lot of people. Maybe John couldn't get any of the fresh produce because they upped the charges of them and upped the price of them during this season. Or maybe because this pandemic, John had lost his job, and maybe that resulted in him losing his gym membership and couldn't afford to buy, the at-home equipment that you might need instead of going to the gym. And so I think here what we're really trying to say is to remember that obesity is such a complex disease, and to never shame anyone for their weight, but instead just always motivate your friends, yourself, and your family to be healthy with you. I think it's the most important part of that. But yeah, thanks everyone for listening. Now we'll go into ways that we can control obesity. The first thing, of course, is the mindset that we talked about, and just realizing that it's such a complex disease, and understanding that we should all just encourage each other, but also the small things, or not small things, but the individual things that we can do, like eat healthier, exercise, manage stress, and sleep. And so just remember all these things do relate to each other, but I'll have Darius talk more about each one later on.
Yeah, and thank you, Sam. I also just want to reiterate what Sam said earlier about making sure we support each other, be there for each other, because building proper health habits is a process. So even do it with each other, and that would be great. So one of the things that we can do to prevent obesity is to eat healthier. Some of the easier things to do is replace a few foods like white rice. You can replace with brown rice and mixed rice. Butter with olive oil, which is a healthier oil option. And then pork and beef, do less pork and beef or replace it with fish and tofu. And chicken's also a healthier meat compared to those two. You also want to make sure you practice mindful eating. And this is when you eat when your body tells you, or eat when you're hungry. Not so much eat when you're stressed or just because you're bored. But it's okay to crave food and eat. Just remember to eat in moderation. You want to eat 5 to 7 servings of fruits and vegetables per day. This one's a little bit harder because it may be hard for some people to get fresh produce, for example. But definitely do your best to just get as much variety as you can, and get ones that you really enjoy, and that'll make it easier to eat them. And limit sugars and artificial sweeteners. So especially when it comes to drinks, you want to make sure you limit soda and even juices, for example. I know that mango nectar juice is really good, but that has a lot of sugar. Most juices actually do have a lot of sugar, so you just want to aim to drink as much water as possible. And then cooking at home can more easily help you more easily watch what you eat, and also help you control how much your groceries cost and how much and what your groceries are. So overall, it's a really great option. The next one would be to exercise. So there's a lot of different things you can do. This can be like going on a 15-minute walk every day with your family. You want to aim for about 120, 150 minutes per week. You can split that up into throughout the week or do like a few days that you are free. You want to stay active throughout the day and take regular breaks from sitting and watching TV. I know with this past year that may have been hard, but there's a few tips to help with that. Even if you have a day full of like Zoom meetings, for example, would be to utilize a standing desk if you can. Take stretching breaks in between Zoom sessions, and then even try to incorporate walking meetings, maybe with your colleagues, coworkers, during work. And then at least get 2.5 hours exercise per week. So this can be split up throughout the week, like I said before. Just really make sure you make it so it fits your schedule. You don't want to stress yourself too much. If you can't miss an exercise, that's okay. Just remember it's a process. So just take it and take it with your time and your own time. And then now we'll be going over a few exercises that we can do. So these exercises, we have a video and we can explain these too, and some of these nice, easy ones you can do at home.
Here's the video, and after that you can see that you can do each of these exercises or pick and choose which ones you like, but you can do these exercises, each exercise 10 times, and then take a break and then repeat it for 2 more times with a break in between that.
Okay, and then one of the other ones too to help prevent obesity is to manage your stress. And this is because when you're stressed, your body releases stress hormones like cortisol, and this can lead to weight gain and cravings. So you want to make sure you really relax as much as you can, because chronic stress leads to carb cravings, for example. You want to learn problem-solving skills. This helps you anticipate challenges and cope with setbacks as they come to you, so that your stress level can be more manageable. And then also look for signs of stress, like for example, anxiety, irritability, and muscle tension. And that way, if you do find these signs of stress, you can find out what stresses you and really work on those obstacles that can stress you, for example. And then you also want to find what works best for you, whether that's exercise, meditation, hobbies, or just finding your own time to just chill and do your own thing. Whatever it is that you do, just really find what works best for you to keep you stressed, as stress-free as possible and as happy as you can. And then you want to eat, exercise, and sleep properly. So just as we mentioned before, everything is connected. So you want to really work on your day as a whole. And then the last thing is to use proper sleep habits. So sleep helps the body rest and recover. You want to make sure you get at least 7 hours of sleep for adults and 9.5 for kids. And then make sure you sleep at regular night hours if possible. The recommended time is 9 p.m. So you don't want to stay up too late. I know those Netflix series are amazing, but you want to make sure you still get the right amount of sleep. You want to avoid caffeine and alcohol before sleeping, as it can mess with your sleeping and your sleep cycle. And then minimize light exposure before and during sleep. And then sleep at the same time every night. You want to keep it as consistent as possible so that your body knows when to start the recovery and resting process. And then, like I said before, remember the whole thing, all 4 of these are related to each other. So look at your whole day holistically and make sure to be patient with yourself, because building proper health habits is a process.
Thank you, Darius. And so, of course, like these things are very important. So we want to be able to provide you resources so that you can get on your feet and start doing these things like cooking more at home and, having it be affordable and accessible to everyone. And so here are a few food things that we can, that are available. So the first thing is CalFresh. It's kind of just like a monthly food program in which you get a little card. It's kind of like a debit card, but it's just for your food. And the government sends money every month to you to be able to buy food and groceries at many places, and many places accept CalFresh. So for example, Safeway, Target, Winco, Walmart, they all accept CalFresh, and even like smaller businesses accept CalFresh as well. You just have to ask. Next is food banks. And so, if you're having trouble getting or affording food, you can try to go to these food banks right here, and there's a number. So there's the San Francisco Marin Food Bank, and then the Mission Food Hub Bank. And then lastly, there's the SF Bayanihan Equity Center Food Access Program. And so you can get food assistance, you can get help with the CalFresh application, and you can go to the grocery program that they have on here. So those are a few things. Next, there's all these websites. All these websites will be in our link tree. You can just scan it here. If you have your phone, you can just open the camera app and, find, or you can just type in the little website down at the bottom, which is tinyurl Linktree MHC. But here are some websites we have. We have some healthy vegan Filipino recipes and not vegan Filipino recipes on the first and second point. And then we have some exercise stuff that you can do. So you can go hiking around areas around you in SOMA. So there's a link of all the places you can go hiking. And then if you don't want to leave the comfort of your home, you can try out the exercises we did, or you can just do the Filipino Zumba YouTube channels that we linked on here. Lastly, we just have our references to make sure that we're giving everyone the right information. Thanks, everyone.